So what we're announcing today is that the St. Paul's Children's Clinics will now become the Bethesda Pediatric Clinic. And so they've been in operations for almost 30 years now, and they're going to become a part of the Bethesda family. And they will continue the operations they've been doing, taking care of babies, all the way from babies up to age 21. And as for a lot of years, we've had kind of a collaborative agreement with them that as they began to age out at St. Paul's, that they would come to Bethesda, and now we'll be all a part of one group and one team, and we'll be taking care of people from babies all the way up into adulthood as they advance over to the Bethesda Adult Clinic. That we'll continue to see them as we've been doing through the years.
Let's talk about how this is going to impact patients specifically, how that seamless, transition of care is going to help people.
Yeah, so one of the challenges you have when you have two community-based clinics, it's always hard to have enough resources to be able to, both financially but also staffing and volunteers to pull this off. And so what it'll allow us to do is combine efforts in our forces, some of our personnel, so that we can continue growing both operations, both the pediatric and the adult clinics, and be able to prepare as we get more and more patients and more needs for those that are underinsured in pediatric realm, those that are in Medicaid, maybe different type of insurances that are hard to find health care. And of course the adults, for those that are uninsured, we'll continue seeing as we've been doing.
Talk a little bit about how your clinic is supported and how you're going to continue to support this new clinic.
So we've been blessed, both clinics have been blessed to have great community support. Significant amount of the operations are covered by the community and folks that live and work in this area to just continue to give to our clinics. But our patients too, we get some patient revenue from our patient fees, a small portion. And then we continue to grow our basis of retail stores called the Hangers of Hope. And they also provide a strong basis for our support. And we're looking forward to announcing when we have some additional news to talk about with our third store opening soon, which will also go to help fund this as well.
What are you looking forward to most with this new collaboration?
Well, I think just getting more formalized how we work together. Dr. Danny Price has been the director there, will maintain as the medical director, and he and I went to medical school, and so being able to work together on initiatives to really help families more so than just the adults or the kids, but to have a more formal arrangement to do that, and just really being able to kind of combine our resources and our efforts to make things better for those that are lower income families in our community.
Do you know off the top of your head how many people are helped at the pediatric clinic or any numbers like that?
I know they have several thousand patients that they see there every year, and so it's probably between the two clinics, probably somewhere between 5,000 to 7,000 families a year or patients would be helped between the two different clinics. So,
is there anything else you'd like to say? Anything you feel that I didn't bring up that you'd like to mention?
No, we're just excited to be able to do this. We're thankful for the community support, and we hope people will see this as a great merger together, and look forward to continue supporting us through the years.
So what's the biggest difference you would say as the clinic in Glendale before kind of being different, and now it's kind of one bigger thing?
So kind of some of the differences, when you have separate clinics, is particularly the combining of resources is going to be the big part. And then we can kind of collaborate on some efforts where we're having to, one clinic may have to hire, say, a nutrition or a social work. Now you can have one that can work between the two clinics and really maximize our resources. So that's a kind of a bigger difference that we have, being able to do this. And as we kind of put our efforts as the community and getting the messaging out, it's always difficult to do in any clinic. And when you have two separate groups trying to do it, it's a lot more difficult than to have one centralized message going out. And people can kind of rally around one area to be able to support the families.